Right now for you at 11 o'clock, we are tracking the very latest on the spreading pandemic tonight. The coronavirus is hitting Connecticut, and we are starting to see the strain it's putting on our state. Hospitals pushed to the limit, thousands applying for unemployment, and there is no end in sight right now.
In fact, doctors are saying we are just getting started. This outbreak putting normal life on hold, really, for many of us. And here at Channel 3, this is our new norm right now. We are also practicing social distancing, sitting several feet away from each other, getting used to it.
I know it is a bit odd, but it's a bit odd for everybody right now, everywhere.
It really is, absolutely. We do have team coverage for you tonight on the effects of this virus, and we start with Channel 3 Eyewitness News reporter Matthew Campbell. Matthew, a lot of sobering figures coming out of these developments today.
Yes, Aaron, you know, we are getting these new numbers that really put this crisis into perspective. Let's start with the number 68. That is the number of confirmed cases we have here in our state. Let's move to the number 6,800. That's the number of cases the state thinks we have. Then the number 9,000. That's the number of hospital beds we have in our state. So you kind of do the math on that. 9,000 beds as these cases multiply. We're not seeing it right now, but experts are worried that the space in the hospitals will soon run out.
The official number of coronavirus cases in Connecticut is 68, but Dr. Matthew Carter from the Department of Health advises us not to get hung up on these daily numbers.
You should assume that there's at least 100 people out there who have COVID-19 for every single positive, which puts us around 6,000 or so, and that might be a low estimate.
And so far, he says the coronavirus in Connecticut isn't even close to peaking.
It won't be long before we start seeing 40 to 50% of those tests being positive.
Doctors say it's not a matter of if, but when that time comes, and when it does, Connecticut hospitals will be pushed to the brink. Only a small percentage will need hospitalization, but experts worry that group will grow as the cases multiply. And we're already seeing it in Fairfield County, where the initial cluster of cases were confirmed just last week.
Greenwich Hospital, they're working 24/7. The doctors and nurses and others haven't been sleeping for days. They're totally full. Same thing in Danbury and in Bridgeport Hospital.
The state says we have 9,000 hospital beds in our state. They don't know how many will be needed when the virus peaks.
Our team is looking at facilities when it comes to university dorms, when it comes to hotel space. We think we've got enough capacity.
But today we learned the state might not have enough nurses to deal with the coronavirus when it really ramps up.
Seeing what we can do to get more nurses available now. We have a number of trainee nurses. We're accelerating their certification. We're also reaching out to retired nurses, those that are retired. We need you, and we're going to need you over the next 2, 3, 5, 6 weeks.
More numbers now, this time on the unemployment front, and this really shows the strain this is putting on all of us. Let's start with the number 40,000. That is the number of unemployed people here in the state on an average day. The next number, 5,000. That's the number of unemployment applications per week during a recession. And then the number 10,000. That's the amount of unemployment applications we saw just yesterday. And that number is expected to climb as experts are predicting the worst is yet to come. That's the latest live here from the governor's mansion. Matthew Campbell, Channel 3 News.